Nutrition 774 initiative is a grassroots initiative. It's people-centered, government-led. The whole idea of the N774 is not that it's a project or a program, but a framework, a movement to allow for a unified response to tackling malnutrition in the country. There's been a lot of good work and efforts by both government in previous administration, development partners, donor organization, civil society, private sector. But a lot of times the work that is being done is done in silos, right? And so what these initiatives aim to do is to, one, bring a multi-sectoral coordination and collaboration. So we have one plan, one strategy for tackling malnutrition in the country. Number two is to drive political will, which is very critical, to make sure that at the various tiers of government, whether it's federal, state, or local government, that the leaders actually act on their commitment. One, prioritize nutrition, release the funds for nutrition, back it up with evidence-based around data, such that they can be held accountable for those commitments made. And then also to ensure that we focus on high impact interventions. Nutrition has so many interventions, but there are limited resources, as we know, financial resources in the country. So how do we prioritize where we'll have the best buys, whatever interventions that we focus on, and to make sure that it trickles down to the grassroots beyond Abuja, but that communities can actually feel the impact. And that's why I said it's people-centered, grassroots, bottom-top approach. So for sustainable financing, we cannot continue to depend on donor organizations. We're aware of recent fund cuts, even by the US government, and as a country, we must take ownership. So what we plan to do is, or what we're driving for political will around, is to improve domestic financing. What this Renewed Hope agenda, of course, under the leadership of President Bola Ahmed Tinubu, and with the Vice President, Senator Kashim Shettima, serving as the chairman of the National Council on Nutrition, what we're doing is to ensure that we put nutrition in the front burner, in the front lines of the national agenda, create the visibility for it, but also, like you said, the financing. So when we go from state to state, and also using the National Economic Council platform, we advocate for improved, increased financing within the budget lines, but not just the appropriation, but the release of the funds, because if the funds are not made available for these interventions, then it becomes empty promises. So that domestic financing is one critical way. In March, the National Council on Nutrition also endorsed a nutrition intervention fund, which is supposed to act as a catalytic funding to where government puts down seed funding, and then we can pull in funds from development partners and donor organizations. There are also conversations around innovative financing of perhaps using tax, like the sugar, sweetened beverage taxes, but those are still in conversations. But again, we must take ownership of our own financing, and the support coming from partners will be more of support rather than the major financing for nutrition in the country. Community leaders, traditional leaders, they are critical. Their role is vital. In fact, without them, this initiative will not succeed, because they're the critical voices, trusted voices of the people. When someone goes to their imam or to their pastor or to the traditional leader, they're most likely going to hear and listen to them and obey their instructions. So we need them as partners in this fight against malnutrition. They can help debunk myths around breastfeeding, or maybe children having access to drinking water and all of that. It's very critical. So we need them to really drive the message to help with the behavioral change aspect for nutrition activities at the grassroots. They're critical to this journey and in this war against malnutrition. The truth is, food insecurity, poverty, those are critical drivers of malnutrition. And to speak actively on what government is doing is, one, government identifies that those do exist, so we're not in denial, but One aspect is you mentioned the issue of RUTFs, ready to use therapeutic foods, right? To ensure that these are accessible and affordable. How do we do it is by encouraging local production rather than importation of these RUTFs. So that's very critical. There's been distribution, for instance, by the Federal Ministry of Health and Social Welfare of commodities like and multiple micronutrient supplements. Again, more can be done, but government is very aware that these are critical. So you have the immediate reliefs, like I said, providing these RUTFs and multiple micronutrient supplements, but also the long term, which is where the Nutrition 774 comes in, is about systems. How do we, while we're mopping up the floor, solving the issue of acute malnutrition, we're also turning off the tap to see that we don't have more children falling into severely acute malnutrition cases. And this is where institutionalization, building, strengthening the systems around not just health, but food systems, education, social protection, water, sanitation, and hygiene. And again, that's where the N774 comes on, bringing all these various sectors together to work collaboratively, but listening first and with that cultural context of what's happening at the grassroots, because Nigeria is like 36 countries in one. And so you have to make sure that our solutions are tailored to what the people need, because what you might think as a solution in Jigawa is very different as a solution in Imo State, where I come from. So government, through the N774, ensuring that we really listen to the people, so that influences the policies that we will set up in the federal government or in Abuja, because the war against malnutrition cannot be won from Abuja. It has to be done at the family level, and which is where us as Nigerians culturally we're the strongest, our family unit. That whole bottom-top approach is the way to go. The N774 is really more like a movement to drive political will, improve financing, data and accountability. It was launched February 2025, and specifically so during the National Economic Council meeting, which rarely happens. This is where the 36 state governors plus one sit and make decisions. So really bringing that to the to the limelight, as a development challenge. And so creating that political visibility is key. So we've been going from state to state since August this year. We've visited 10 states so far, and some of the wins there, apart from establishment of the State Council on Nutrition, tangibly we've seen an increase in release of funds. I'll give you an instance. In Cross River, the funds, there's been an increase from 48 million naira to 154 million naira. This is within 3 months of visiting. So it creates, like I said, that visibility and drives that political commitment by the governors with measurable, actionable steps. There's also been a commitment by local government chairman in Jigawa, I think 13 million naira monthly that they've committed to tackling the malnutrition through their Masaki program. Again, that's unique to Jigawa, right? They've developed their own program that works for them. We've also seen renovations of creches, which is necessary to encourage exclusive breastfeeding in Abia State and Cross River as well. There's also been a call for nutrition experts being pulled into the civil service system, and of course establishment of nutrition departments across the various ministries, which will allow for a budget line to be able to implement nutrition interventions. These are just a few of the wins that we've already seen, like I said, within 3 months to 4 months, and we're hoping to see more. Next steps would be to cover more states, but also continue with the peer learning with the states visited. What has worked for state A, what has worked for state B. I forgot to mention, through to the Child Nutrition Fund, which is propagated by UNICEF, but also in the support of Gates Foundation and a couple of others. There's been a release of funds. Zamfara, for instance, released 500 million naira for a match funding with UNICEF. So how that works is for every $1 government brings, there's a counterpart funding or match funding of another dollar. I believe Jigawa released 250 million as well. So this would help increase the funding available for nutrition and would help with implementation. So the next steps is really to continue with the drive for the political will, the establishment of the Nutrition Intervention Fund to allow for more funds as innovative financing, which will be result-oriented, result-based. So for states that are doing well, they get more money to do more. Driving ownership at the subnational level is key. Private sector is also critical. And so there are plans on the way to pull in private sector, not just for CSR, but to take a look at their manufacturing of fortified foods, right, staple foods, so that we can get these nutrients into our households and for our children to be able to grow, learn, and thrive. The media, you're the voice, and you can also hold government accountable, not just federal government, but the subnationals as well, to say, well, you had promised under the N774 in August that you will deliver 1, 2, 3. Now we're 6 months down the line. Here are the questions. So your voices as media is critical in ensuring that our children are properly fed, get access to the right nutritious food, and of course that the grassroots truly take ownership of this initiative. All the states have. I just chose a few to highlight. I mentioned the crèche as well in Cross River and the release of funds or increase in release of funds from 48 million to 154. Again, there are other states that even prior to our visitation have also made commitments. I'll give you an instance. Bauchi, so they're not necessarily waiting for us to come from federal level, and that's what we want. Like I said, ownership at the subnational level. Bauchi State has also approved for the 6 months maternity leave and 2 weeks paternity leave, which is very critical, so that our men can support their wives. And so, yes, I've mentioned 10 states. But there are states that are going on to take actions even prior to our coming. For instance, even Nasarawa has set up, we've not been there yet, but they've set up their state council on nutrition. Again, it's a movement. It doesn't wait for His Excellency the Vice President or the federal delegation to move in. It's creating the buzz, the importance of nutrition for cognitive development, workforce productivity, growth of a nation, such that everybody picks that buzz and moves with it in a way that is tailored to what their own needs are. And so in terms of the presidency, what the presidency is doing, the vice president also serves as the chairman of the National Economic Council. So he always brings issues of malnutrition, health, to that platform and discussing with them. We also leverage the nutrition scorecards, national scorecards developed by the Nigeria Governors Forum. That's also a platform. So we're not just speaking verbally, we're showing states this is what your performance looks like. And that endears them to want to act more. I'll give you an instance. Cross River saw that they have all greens except for 2 items. And they said, you know what, come back early Q1 of next year, and those reds will now be green. That's the kind of advocacy and accountability that we're driving through the Nutrition 774 initiative. And there's been, like I said, projects that have been ongoing, like the Accelerating Nutrition Results in Nigeria and RIN. That's still going. What N774 does is it's just an umbrella that allows all these other projects, whether it's by different development partners, to have a unified response system. So we're pursuing one target, or one budget, one plan, and several targets, but streamlined to best results.
Wonderful. Yes, I remember at the Rockview meeting, you were very vehement about the issue of coordination. I mean, a central point where this data is tracked and then can be. So that's where it comes in now. You see, where states have to load what they're doing on a dashboard, and at the central level, everybody has to assess. So where's the place of data? A central one, coordinated in all of this.
Data, first of all, data is critical. Without data, we're running blind. We can't say what we're doing well, where we would need to improve. So we identify, this administration understands that it's as critical as even the coordination itself. The central one is domiciled in the Ministry of Budget and Economic Planning, which is by policy the coordinating ministry for nutrition in the country. And of course, that's cascaded also at the state level. Budget and Planning does the same thing. And so the whole idea is we have a dashboard now, and when states sort of collect and collate their results and information, they're able to feed it through a backbone from local government to state, through the SCFN as well, and then to the national, where at the end of the day, the vice president and chairman of the National Council on Nutrition can sit and see how the states are performing, then in turn go through the neck and say, well, I won't mention any state, but this state you need to do well, this state you need to improve. That's the whole idea. Of course, there are gaps, and we're working closely with the technical expertise of development partners. They've been really supportive to close those gaps and to strengthen and institutionalize what we're doing and the gains that we've had so far.
Well, on a final note, N77 sounds from your explanation as a game changer,
Yes.
but the digits are not actually dwindling at all. Nutrition is physical. It's very, very glaring in Nigeria. What will be your final word to Nigerians to bring hope and assurances that, well, the figure's not friendly, but this administration is working tirelessly to change the game?
My final words to Nigerians would be, tackling malnutrition is not for government alone. It is one that requires our collective effort, from the mothers to the leaders at the community level, families. Everybody must come together. There must be that ownership by the people, to stand and say, you know what, malnutrition has no place. So we're talking about activities, even homestead gardening. What are we doing to ensure that at the back of your house you've planted a few things rather than waiting for government to do a palliative, right? Government will do its own bit, and that's the commitment, that's the promise from President Bola Ahmed Tinubu. But it takes a collective effort, private sector, civil society organizations, media, development partners, and of course with government really providing that guidance for how we would move. And so we can tackle this. If there's any country that has the ability to fight malnutrition, it's Nigeria, because we are blessed, not just in natural resources, but we are blessed with human resources as well. And so we have what it takes. We just need to work collaboratively together to tackle this issue.
Be the first to get notified about new episodes of the program Power Hour. Click subscribe to ZTTV now. Power Hour. Empower one. Inspire all.